Hello, myself Dr.Dnyanada, and I would like to talk about what happens when a patient approaches a homeopath for his long-standing treatment. Long-standing is also termed as chronic disease in homeopathy. So generally, not a rule though, patients generally approach homeopaths as a last resort of treatment. And when I say the last resort, I mean to say that the system is already under the blooming effects of steroids, maybe antibiotics, of local applications, etc. So, given this scenario, is it feasible to expect a recovery within a short period of time? Not because homeopathy takes a long time to cure, but because you have a disease that is chronic, that is long standing, right? But yes, what is visible is you will have an alleviation of your symptoms as you start homeopathy. Okay, it's a process of decluttering your house, where you place all the things in order and you discard the unwanted things. In the same way, when you start the homeopathic treatment, you know, there is not a specific treatment plan, because homeopathy believes in individualization, in which every individual is different. Every person's reactivity to the medicine given is different, right? And in this road of healing, there will be turns and twists, and it is not a smooth road to recovery always. It can be though. So what I mean by this, okay, I have patients who have COPDs, like obstructive pulmonary disease, with eczema, with some mental issues as well. Like sometimes it's a form of complex disease where two or more than three, four, five symptom gets mixed and it forms a complex disease. So in such a scenario, when they start with the homeopathic treatment, if the patient has got eczema with COPD, maybe sometimes his eczema gets flared out, but he actually feels better with his lung issue. There are a lot of secretions, but he tells that, doctor, yes, the wheezing has subsided, though I am getting a lot of secretions and they're actually making me feel better. This is what I mean by flare up. And in this scenario, you just have to visit your homeopath, give the thorough details of your symptoms or your complaints at that very moment, and then the homeopath will prescribe thereby. Visiting the homeopaths at regular intervals, doing the follow-ups with him or her is very crucial in your long-standing treatment plan. Okay? And sometimes the flare-ups won't be there. It can be a steady and slow improvement with leading to eventually recovery. And last but not the least, you have to get counseled yourself from your doctor about your lifestyle management, about your food habits, about your sleeping habits, about your exercise, which is very important and which will just enhance your healing. And by doing this, you align your body, mind, and spirit in a proper way, which is called as Trinity. And when this alignment happens, we call it as health. So, wishing you lots of healing